Welcome to our NPTE Question of the Day series presented by Typical PT. Today, we are going to discuss a question from Typical PT's platform. Let's jump right in. Here's our question. A 65-year-old female patient is referred for management of lymphedema in her left lower limb. The patient, a retired teacher, has a history of breast cancer for which she underwent a mastectomy and lymph node dissection 2 years ago. She is currently on tamoxifen and reports a gradual increase in the size of her left leg over the past year, which becomes more noticeable by the evening. She denies any pain, but mentions a feeling of heaviness in the affected limb. On physical examination, you observe non-pitting edema in the left lower limb, extending from the thigh to the ankle. The skin appears slightly thicker than the right limb, with early signs of fibrosis, but no significant color changes or skin folds. There's no evidence of ulceration or infection. Based on the clinical presentation, what stage of lymphedema is the patient most likely in? Here are your answer choices. A. Stage 0, B. Stage 1, C. Stage 2, D. Stage 3. Go ahead and pause the video right now. Think through the logic and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice C, Stage 2. Before we break down the explanation, I want to mention that the infographic shown here is from the Physical Therapy Essentials book from Typical PT. You can find this diagram and other helpful resources inside that book. Now, let's explain why this answer is correct using the stages of lymphedema chart. As looking at the chart, Stage 2 is known as the spontaneously irreversible stage. The key indicators in the patient's presentation that align with this stage are the presence of non-pitting edema and early fibrosis, which is the thickening or hardening of the tissue. In this stage, the swelling is no longer soft or reversible with elevation alone, and the tissue texture begins to change, becoming firm or brawny. Now let's look at why the other options are incorrect. Answer choice A, Stage 0, is incorrect. Stage 0 is the latency stage, where there is impaired lymph transport, but there is no visible swelling. Since our patient has observable leg enlargement, we can rule this out. Answer choice B, Stage 1, is incorrect. Stage 1 is the reversible stage. It is characterized by soft, pitting edema that typically reduces significantly with elevation. Our patient presents with non-pitting edema, which indicates progression past Stage 1. And finally, answer choice D, Stage 3, is incorrect. Stage 3 is known as lymphostatic elephantiasis. As you can see in the far right of the diagram, this stage involves severe skin changes such as hyperkeratosis, deep skin folds, or warty overgrowths. Since the question states there are no significant skin folds or color changes, the patient has not yet reached this advanced stage. Now that you've gone through this case, take a moment to jot down all the key points in your Typical PT digital notebook. Use it to organize your notes, highlight concepts you found confusing, or mark areas you want to review later. This feature isn't just for note-taking. It can serve as your personal reviewer, helping you track what you've mastered and identify topics you still need to strengthen, ultimately improving your retention and understanding. Thanks for watching today's Question of the Day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.